Pain is a complex signal our body sends. It tells us something is wrong. It can be a sharp warning from a new injury, or it can be a dull, constant ache from a chronic condition. For many years, the primary response to pain has been to reach for a pill. Medications like NSAIDs or opioids can offer quick relief, which is sometimes necessary. However, they are not always the best long-term solution. Many people are now looking for safer alternatives because they worry about the side effects of long-term medication use. These can include stomach problems, liver damage, or even the risk of addiction. This growing awareness is leading people to explore other ways to manage their discomfort and heal. The search for non-drug pain relief is not about rejecting modern medicine. It is about expanding our toolkit. It is about understanding that our bodies have a remarkable capacity for self-healing. We simply need to learn how to support this natural process. Relying solely on medication can sometimes mask the underlying cause of the pain. It can be like silencing a fire alarm without putting out the fire. By exploring holistic methods, we are not just covering up the symptom, we are addressing the root issues. This approach empowers us to take an active role in our own health and well-being, moving from being a passive patient to an active participant in our healing journey. Many people find that their pain is not just a physical sensation. It is deeply connected to their emotional and mental state. Stress, anxiety, and depression can make pain feel much worse. This is because our nervous system becomes more sensitive when we are under mental strain. Conventional medicine sometimes overlooks this powerful connection. Holistic approaches, on the other hand, place great importance on treating the whole person, mind, body, and spirit. This integrated view acknowledges that to truly relieve pain, we must also calm the mind and soothe the spirit. It is a more comprehensive and honestly, often more effective way to find lasting comfort. The journey away from a dependence on pain medication is a personal one. It requires patience, curiosity, and a willingness to try new things. It might mean changing long-held habits or beliefs about how to handle discomfort. But the rewards can be profound. People who successfully adopt holistic pain management strategies often report not just less pain, but also more energy, better sleep, and a greater sense of control over their lives. They discover that true healing comes from within. By providing our bodies with the right conditions, we can unlock our own innate power to heal and thrive, reducing our reliance on external fixes and building a foundation of lasting health. One of the most powerful tools for pain relief is movement. When we are in pain, our first instinct is often to stay still. We fear that moving will make the pain worse. However, gentle and appropriate exercise is often one of the best things we can do. Activities like walking, swimming, or yoga can help reduce inflammation, which is a common source of pain. Movement also releases endorphins. These are our body's own natural pain-relieving chemicals. They work in a similar way to opioid medications, but without the harmful side effects. Starting slowly and listening to your body is key to making exercise a safe and effective part of your pain management plan. Physical therapy is another cornerstone of non-drug pain relief. A skilled physical therapist can be a valuable guide on your healing journey. They do more than just give you exercises. They assess your specific condition to understand the root cause of your pain. They can identify muscle imbalances, poor posture, or movement patterns that are contributing to your discomfort. Through targeted exercises, manual therapy, and education, they help you restore proper function. This not only relieves current pain, but also helps prevent it from returning. Physical therapy empowers you with the knowledge and skills to care for your body and move with greater ease and confidence. Simple therapies using temperature can provide significant relief. Applying heat, such as with a heating pad or a warm bath, can be very effective for stiff joints and muscle soreness. Heat increases blood flow to the area, which helps relax tight muscles and deliver healing nutrients. On the other hand, cold therapy, like using an ice pack, is excellent for new injuries and inflammation. Cold constricts blood vessels, which can reduce swelling and numb the sharp acute pain. Alternating between hot and cold therapy can also be beneficial for some conditions. These simple, accessible techniques are powerful ways to manage pain directly at home. Diet plays a crucial role in managing pain, especially pain related to inflammation. Many common foods in the Western diet, such as processed sugars, refined carbohydrates, and unhealthy fats, can promote inflammation throughout the body. By shifting to an anti-inflammatory diet, you can help calm your body's pain response from the inside out. This means eating more whole foods like fruits, vegetables, healthy fats found in olive oil and avocados, and omega-3 rich fish like salmon. Spices like turmeric and ginger are also powerful natural anti-inflammatories. What we eat is a fundamental part of our health, and making conscious food choices is a direct way to support our body's healing. The mind is an incredibly powerful tool in how we experience and manage pain. Our thoughts and emotions can directly influence the intensity of physical sensations. When we are stressed, anxious, or fearful, our bodies release stress hormones like cortisol. These hormones can make our nervous system more sensitive, effectively turning up the volume on pain signals. This is why two people with the same injury can report very different levels of pain. By learning to calm the mind, we can directly influence our physical reality. Techniques that focus on the mind-body connection help us regain a sense of control and reduce the suffering associated with chronic pain. Mindfulness and meditation are ancient practices with modern scientific backing for pain relief. Mindfulness is the practice of paying attention to the present moment without judgment. When applied to pain, it doesn't mean ignoring the sensation. Instead, it means observing it with a sense of gentle curiosity. This simple shift in perspective can change your relationship with the pain. It helps to separate the physical sensation from the emotional reaction to it. Studies have shown that regular meditation can actually change the structure and function of the brain regions involved in processing pain, making people more resilient to discomfort over time. Breathing exercises are another simple yet profound way to tap into the mind-body connection. When we are in pain, our breathing often becomes shallow and rapid, which activates the body's fight or flight stress response. By consciously slowing down our breath, we can switch off this response and activate the parasympathetic nervous system, also known as the rest and digest system. Deep diaphragmatic breathing sends a signal of safety to the brain. This calms the nervous system, relaxes tense muscles, and can significantly reduce the perception of pain. This is a tool you can use anywhere at any time to find immediate relief. Cognitive behavioral therapy, or CBT, is a well-researched approach that helps people change the negative thought patterns that often accompany chronic pain. A therapist trained in CBT can help you identify and challenge thoughts like, "This pain will never end," or "I can't do anything because of my pain." By replacing these unhelpful thoughts with more balanced and realistic ones, you can reduce feelings of helplessness and depression. This change in mindset can lead to a real reduction in pain levels and an improvement in your ability to engage with life. It teaches you that while you may not always control the pain, you can control your response to it. Adopting a holistic approach means looking at the big picture of your health. It is not about finding a single magic bullet for pain. It is about creating a lifestyle that supports your body's overall well-being. This comprehensive strategy weaves together many different threads: what you eat, how you move, how you manage stress, and the quality of your sleep. When all of these elements are working together in harmony, the effect is much greater than the sum of its parts. Holistic care recognizes that you are a complex, interconnected system. True and lasting relief comes from nurturing the entire system, not just treating an isolated symptom. The evidence supporting these integrated treatments is growing stronger every day. Numerous studies have validated the effectiveness of approaches like physical therapy, mindfulness, and anti-inflammatory diets for managing chronic pain conditions such as arthritis, back pain, and fibromyalgia. Researchers have used imaging technology to show how meditation can change brain activity related to pain. They have tracked how specific exercises can restore mobility and reduce the need for surgery. This body of evidence is moving these alternative methods into the mainstream, where they are now recognized as legitimate, evidence-based components of comprehensive pain care. The benefits of a natural and holistic path extend far beyond pain relief. When you start eating better to reduce inflammation, you may also find you have more energy and lose excess weight. When you practice mindfulness to manage pain, you may also find that your relationships improve and you feel less anxious in general. When you begin a gentle exercise program, you not only strengthen your body against pain, but also improve your heart health and mood. This is the beauty of holistic care. The positive changes ripple out, enhancing every aspect of your life and leading to a deeper, more resilient state of overall wellness. In summary, the journey to effective pain relief does not have to be limited to the pharmacy. By embracing the principles of holistic health, you can unlock your body's profound natural healing capabilities. Through a combination of mindful movement, targeted physical therapy, a nourishing diet, and stress-reducing practices, you can build a powerful defense against pain. This approach is not a quick fix, but a sustainable path to long-term health and vitality. It empowers you to become an active partner in your own healing, offering a future with less pain, greater mobility, and an enhanced quality of life. True healing addresses the whole person, creating a foundation